You've seen the videos, people walking around pointing sensors at things or connecting sensors to themselves, getting some numbers, look at those big numbers, and then making suspiciously confident claims about what those numbers mean when it comes to health and wellness. And so it is the case with grounding, or earthing as it's alternatively called. But what is it? Should you do it? And should you relinquish some of your hard-earned cash to do so? Now, grounding is essentially establishing direct contact between your body and the earth. It's sort of a natural medicine claimed to alleviate all sorts of maladies inflicted by our modern, unnatural lifestyles, from diabetes to cancer to Alzheimer's to more persistent issues like poor sleep and chronic pain. Now, there are many ways to ground yourself to the earth, the simplest of which is just to take off your shoes and walk around in the grass. But if that's too inconvenient, there are plenty of commercial goods with free shipping and next-day delivery just waiting to fill your every need. From grounding pads to bed sheets and pillowcases and even shoes, there's no shortage of gadgets that will claim to connect you to the natural earth from the comfort of your cozy and very synthetic home. But do they actually work, and will they improve your health? Now, proponents of earthing suggest that electromagnetic fields, or EMFs, which are generated by all sorts of modern devices, from power lines to cell phones, Wi-Fi, radios, and so on, these EMFs generate a small electrical potential, or voltage, across our bodies. And furthermore, in our man-made environments, we're often insulated from the earth, so we won't neutralize these potentials. Proponents of grounding make further arguments that prolonged exposure to man-made electromagnetic fields, even weak fields from cell phones and such, can cause detrimental health effects over time. And we can talk more about EMFs at another time, as that's also a complicated subject. Now, if those EMFs are harmful, then grounding ourselves might mitigate some of those health risks. Proponents of grounding claim that the electrons that flow into our bodies when we're in direct contact with the earth can essentially act as antioxidants. They claim that prolonged insulation from the earth can result in inflammation and all sorts of chronic illnesses. And let's establish one thing. When you walk around outside without shoes or use these grounding products, if they are properly built and used, they do actually ground you. But does grounding have any impact on health? Skeptics will point out that most of the arguments for grounding have very little scientific support, and they don't even propose a sensible mechanism of action. The claim that electrons from the earth applied to the outside of our bodies will behave internally like antioxidants that we get from foods or dietary supplements is a little questionable. Skeptics claim that essentially the argument for grounding is an appeal to nature. For the vast majority of human existence, we've been in direct contact with the earth, so going without it must be bad for us. Now, one paper goes so far as to create this nifty little chart correlating the increase over time in adoption of synthetic rubber-soled shoes, which insulate us from the earth, with increasing rates of diabetes. But while this argument might appear convincing at first glance, it's still just correlation. We can similarly correlate rising rates of diabetes with increases in college degree holders, the number of cars on the road, or the number of fast food restaurants in the United States. Actually, that last one seems much more plausible as a causative agent. But, as they say, talk is cheap, and we can speculate all day without getting anywhere. What does the research say about grounding? Now, at this time, there aren't a lot of clinical studies on grounding. The few that do exist suffer from very low numbers of participants, lack of controls at times, and suspicious data analysis. But let's learn what we can. Now, if you don't want to sleep in the dirt, the next best thing is to plug your bed sheets into your electrical outlet. Sleeping while grounded is purported to improve sleep quality, so says the manufacturer. But is it true? Well, there are a couple of studies. This one looked at a very small number of participants, just 12, all of whom reported chronic difficulty sleeping. All of the participants were given a grounded mattress pad, that's right, there was no control group, and they slept on it for 8 weeks. Cortisol levels were measured at the start of the intervention and 6 weeks later, and participant sleep quality was surveyed at the end of the test. While the authors claim that most patients had cortisol patterns more closely matching the normal circadian pattern after their 6 weeks of treatment, they don't show any quantitative data or provide any statistical analysis. Now, participants did report a subjective improvement in sleep quality, but without a control group, it's impossible to rule out placebo. There's another study here with a few more participants, 60 in total, and participants slept on a grounding pad for 30 days, and they included a control group, which slept on non-grounded pads. Participants were surveyed at the end of the test, and the grounded group indeed reported improved sleep quality and wakefulness and reduced muscle stiffness and chronic pain compared to the ungrounded group. It's not clear from the paper, though, if participants knew which group they were a part of, so again, placebo is a concern. And still, subjective surveys don't make for particularly convincing data. Now, there are a few more studies examining other potential health effects of grounding. Here's one in which 16 massage therapists stood on grounding pads while working for 4 weeks compared to blinded controls who got sham grounded pads, or essentially grounding pads that weren't actually grounded. They measured blood viscosity, heart rate variability, and some markers of inflammation like IL-6, TNF-alpha, and CRP. But the results are hard to interpret, and I struggled to find any noteworthy trends in the data. Even the authors had a hard time making sense of the data and mostly just claimed that people are more stressed during the Christmas holiday than after the New Year. Thanks. What about this one? There were 28 participants that were treated with grounding pads on the soles of their feet and the palms of their hands for 2 hours. Participants were ungrounded for the first and last 40 minutes of those 2 hours, so they were only grounded for the 40 minutes in the middle. And then there was a control group that was treated similarly, but their pads were never grounded. The scientists measured heart rate variability, and it's not obvious to me that there's any difference between the grounded group compared to controls. All of the data looks very noisy, and they don't even show data from the entire 2-hour test. Now, the authors claim that grounding did show a statistically significant difference, but only by comparing the last 10 seconds before grounding to the last 10 seconds of the grounding treatment. It's unclear to me why they only compared 20 seconds of data between the groups when the grounding session lasted for a full 40 minutes. Here's another one. This one, by the way, was funded by EarthFX. That's a company that sells grounding mats, just so you know. Now, similarly to the last study, this one had participants sit on grounding mats for an hour. And again, this one was also double-blinded, so the control group had disconnected grounding pads. The authors measured skin surface temperature variability by thermal imaging. They claimed that more uniform skin surface temperatures are associated with better blood flow, and that grounding would improve skin surface temperature uniformity. And indeed, they claimed that their study results showed that the grounded group had more uniform skin surface temperatures compared to the ungrounded group. But these statistical analyses were only performed on 3 of the 27 treatment participants and 3 of the 13 control participants. I'm not sure why they analyzed data from only 6 of the 40 total participants, or how they selected which of those 6 would be analyzed. The authors merely claimed that it would take too long to analyze all of the data. And apparently the peer reviewers were okay with this. So it's really hard to draw any conclusions from this study. The sample size is tiny, the differences in skin surface temperature patterns between the groups is variable, and there's not really any attempt to relate the specific observed skin surface temperature differences to any real health outcomes. In general, the scientific literature on grounding is pretty sparse, and if I'm honest, it's kind of bad. I'm actually surprised that many of these papers were published. I would need to see much higher quality studies with much larger sample groups before I could recommend grounding, at least from an evidence-based standpoint. So, what can we conclude? First, earthing products do actually ground you, presuming your home electrical system is properly grounded and you can buy devices to test this. Grounding products do actually connect you to the earth, and they reduce your electrical potential. Citizen scientists and peer-reviewed studies alike have shown this. But there is not good evidence at this time that grounding actually makes a difference to our health. And furthermore, there aren't very substantial claims as to why grounding should improve our health. That said, grounding products are, for the most part, inexpensive and very easy to use. If you've tried everything else and you're still struggling with a health problem, the cost to try grounding is pretty negligible. You can even do it for free if you just take off your shoes and walk around in the grass. I'll give grounding a plausibility rating of 2 out of 5. There aren't any solid theories at this point to suggest that it should be beneficial, but at the very least there's nothing about grounding that's inherently incompatible with modern scientific knowledge. For science or supporting data, I'll rate grounding at 1 out of 5. There are a few studies out there, but again, most of them do little more than generate a hypothesis that will require a much more robust study to validate. And for impact, I will rate grounding at a 3 out of 5. I can't support some of the more questionable claims like using grounding as a treatment or prevention for things like diabetes or cancer, but grounding is most commonly used, it seems, to treat poor sleep quality and chronic pain. And these are already conditions which, in many cases, are hard to diagnose, let alone treat, with modern methods. The cost to implement earthing into your lifestyle with something like grounded bedsheets, conversely, is very easy. It is true that the science doesn't seem to support grounding right now, but it doesn't hurt to try it if you've exhausted your other options, especially for difficult issues like chronic pain. There's a lot of anecdotal claims out there, people who said they've used grounding products and experienced all sorts of health benefits. And whether the effect is real or placebo relief is still relief. But of course, always consult a medical professional for a more comprehensive assessment of your individual situation. But that is all for today. If you have any thoughts, please feel free to comment. Have a great day and be well.